Hey everybody, Coach Josh from CrossFit Methodist here. Today we are going to start a new series. This series is what we call our Fix Friday series. And over the month of September, we're going to focus on a certain topic. That topic is going to be shoulder health. So today, I'm just going to provide you a video with a little bit of getting someone aware of the issues of shoulder health or kind of what we look for in shoulder health for our athletes. And then over the coming Fridays, we'll talk more about maybe some solutions and then actually the solutions that we provide you. So first of all, when we're looking at shoulder health, we want to evaluate an athlete's status. Is it a mobility issue or is it a stability issue? So when we're talking about stability, okay, stability happens either at the joint, okay, or it could be through muscle strength. So stability is a strength issue, okay, or an athlete might be weak in a certain area, okay? So when we're looking at stability, stability is addressed through strengthening type exercises. So it's very important that I note whether an athlete is unstable, okay, or an athlete is immobile. Immobility is an issue of flexibility. So that might be a term that most of you are used to hearing is flexibility, okay? So are my muscles tight? Or is the joint at which my body's trying to move on, is that tight, okay? So I can have a joint restriction or I can have a muscular restriction. So if an athlete can't get their arm all the way overhead, that's a mobility issue. If an athlete can't hold a bar overhead, that might be a stability issue, okay? So we address that differently. One, through flexibility or strengthening, okay? Number two is posture. So we're going to evaluate an athlete's posture in standing, and then also assess their posture in sitting. Typically, most of our clients are going to come into us after 8 to 10 hours of sitting at a desk. That doesn't include then their commute to work. Some of our clients might have a 10-minute commute to work. Some of our clients might have an hour and 10-minute commute to work. So we have to assess the athlete's posture really from the get-go, because most of them are coming in with a postural issue that we really can't help over an hour of training because they're taking away from it over the 12 hours that it might be at work. So, and then lastly, the other thing that we're going to assess is previous history of injuries or issues. So if an athlete's had a previous history of an injury, that could then lead to a current injury coming up. So we're going to look at the history to see what might happen in the future or in the present that the athlete's coming in with. So over the next few weeks, we're going to be progressing you along this video series to talk to you more about how we're going to fix the shoulder. Thanks, guys.